Are your bones strong enough to carry you through a lifetime? This Mindful Monday, we're tackling osteoporosis. The National Osteoporosis Foundation estimates half of women over 50 will eventually develop the condition. This morning, we're joined by Barb Helgeson, a physical therapist with Mayo Clinic Health System. Good morning, Barb.
Good morning.
So osteoporosis or osteoarthritis, two words we hear a lot, but what is the difference between the two?
So despite the fact that osteoporosis and osteoarthritis are completely different diseases, they are frequently confused.
Yeah.
Both of them begin with the prefix osteo.
Right.
Osteoporosis is a bone disorder where actually there is a decrease in the quantity and quality of the bone, which can lead to fractures. Typically, we do not know we have osteoporosis until it's too late. Thus is coined the silent disease.
Okay.
Osteoarthritis is actually a degenerative joint disease where you actually get pain, stiffness, loss of range of motion. A person can actually have both osteoporosis and osteoarthritis.
Okay, I was going to ask that. And does one kind of lead into the other, or are they separate?
They are totally separate. They
Okay.
are totally separate diseases.
Okay, so they are separate there.
Yes.
And so just explain to us what is osteoporosis and how it affects the bones.
So osteoporosis, again, we get a change not only in the quality of the bone, but the quantity of the bone. So as you begin, it actually means porous bone. So because you have less bone or the quality of the bone, it can lead to fractures. And that's where many times the diagnosis of osteoporosis doesn't come till after a fracture. Many of us do not know we have it. There's many phases of osteoporosis out there.
Okay, and why is it so common in women over 50, and anything we can do about it?
So, you know, that's a good question. It's not just women over the age of 50. As women, we do lose our estrogen, which is our bone fertilizer. But the fact is that men also get osteoporosis. And it's quite common in men, actually. When we look at actually 1 in 5 men over the age of 50 will actually sustain a bone fracture from osteoporosis. Pancreatic cancer in men, especially with hormone therapy, can also lead to osteoporosis. With females, many of them, not only it's lifestyle and genetic, but many of the medications that we take that we need for other conditions. Some of our cancer medications, some of the medications for GI abnormalities, celiac disease, irritable bowel syndrome, other things like that. Long-term prednisone use can actually decrease the bone, and we don't know what's happening. It's inside of us cells. It's like a silent thief that's coming in and taking our bone away, sometimes until it's too late, till we sustain that compression fracture.
Okay, and so if women or men are starting to experience some of these symptoms, should they speak with their doctor about, you know, are my medications causing this, or what do you recommend?
Yes, definitely.
Okay.
You know, really establish a good working relationship with your primary care physician. That's always a great thing. But the other thing is if you start to lose height, like 1 inch of bone, you're losing height, you're changing your posture, you're noticing things like that. If you have a fracture, we call it a fragility fracture or a fracture from a low level, a curb, you step off of a curb, you sustain a wrist fracture that you might normally not have sustained in earlier years. Those are all risk fractures as well. As you know, talk with them about your different medications and your underlying conditions. We know, like again, rheumatological, endocrine, disordered eating, any of that can bring to the surface.
Okay, and quickly before we go, any top things you recommend, you know, women, men should be doing to help stave off this condition?
So definitely a multi-component exercise program. So resisted exercises, really in good form, trying to avoid spinal flexion, but working the muscles that cross the spine and the hips. Weight-bearing exercises are critical to bone building. However, we need to be exercising at 2 to 4 times our body weight. So walking is a great exercise, however, it does nothing for our bones.
Okay.
And balance exercises, that's one of the things that we really are forgetting about, is trying to incorporate balance. Balance can be increased just like your muscle strength. So incorporating single leg standing or at least 15 to 20 minutes a day throughout your day. Trying to just be bone smart, bone health.
Great. Well, thank you so much.
You're welcome.
Important insight you shared with us.
Thank you so much.
Thanks for being here, and stay with us. We're back right after this.
Okay.